Nagaland Health and Family Welfare Principal Director spoke to NE8 about the current COVID-19 situation in the state.
As of in the metro cities, Dimapur, Kohima, apparently it appears that the situation is slightly improving. But as of the news that we are getting from the districts, it appears that it is now going into the rural areas, for which we have already worked out the surveillance team to work at each level, maybe at the district hospital, the community health centers, the primary health centers, and even at the sub-centers, how to work out the modalities and to carry out, maybe in terms of contact tracing or even for vaccination, and to even mobilize the staff to collect the data so that we get the right figure to get information to the public. For somebody to point fingers at someone, there is always room for that to happen. But on the part of the government, starting from the last COVID to the present, last year sufficient number required amount of medicines, be it or equipments or surgical items, have been provided to all the districts in every way possible. Now, taking stock of that situation during this second phase, we have a team constituted leading by a senior officer in the department to represent each district. Now they get their daily reports from the districts, from the MSs and the CMOs, whereby their problems or whatever that is happening is being taken into account, and on a daily basis here in the directorate we have a committee called the Peace Zone, whereby all these problems are shared in the meeting. We discuss over the issues and address to them day by day, and pertaining to the requirements in the districts. Till as of now, we have not run out of these or that medicines. In whatever way possible, maybe in between one or two items may run out, but the life-saving drugs are always made available to the districts. And even as of today, we have been putting our proposal to the government for further requirements, and whatever sanction that comes, we have already prepared, and the supply orders are already given to the suppliers, giving a limited time period so that they can give us supply to the department to meet the requirements. I think to start with, no doubt, we have a poor performance. I mean, this is all because even as medical professionals, not all are alike. In the social medias and things like that, wrong informations are given, and that is how many people backed out to take the vaccination. But as the time goes by, now everybody is realizing that vaccination is a must to stop the third wave, and that is very clear. And if we compare to the developed countries where vaccination is done on a massive scale, now people are even going around without wearing masks.
Yes.
So the way the vaccination should go, maybe the manufacturers cannot suffice the manufacturing of vaccines for the huge population in a country like ours. But as we have been hearing that the production will gear up, more vaccines will be produced, and as per the information given by a cabinet minister by the union government, says that by the end of the year the whole of India will be getting their vaccines. But I don't know how true is that, but hopefully if we get ample vaccines at hand, we should be able to vaccine the entire population, hopefully. And even for Nagaland, for example, we have 612 vaccine centers, and for which if we get adequate vaccine supply, we should be able to cover up our population.